Let me give you a sense, first of all, of why the foundation and we started this project. And some of this you heard Marianne talk about this morning. We spend a huge amount of money on healthcare, not news to you. Michigan spends a huge amount of money on healthcare and don't get the outcomes that we think we should be getting or that other countries get. If we look at sort of the care that people should get versus what they do get, there's a huge gap. There was one major study that many of you probably saw a few years ago that said that Americans get about 55% of the health care they should be getting. If we look, for instance, at, do you get vaccinated for flu or for pneumonia, those sorts of things? Do women get mammograms when they should? We see huge gaps between the actual care that's being provided, the levels, versus what we know research and evidence says we should be getting. It's the kind of thing we wouldn't tolerate anywhere else. We wouldn't tolerate that in the auto industry, for instance, yet we tolerate that in healthcare. We certainly couldn't tolerate that in the airline industry, where we expect every flight to be flawless, but yet in healthcare sometimes things seem to be sort of loose and it's sort of an adventure in terms of what we actually get. We know that in many doctors' offices there's good care being provided. We also sometimes know that there's sometimes not good care being provided. And then beyond whether or not people get the care they should be getting, we often find that there are mistakes, miscommunications, things where people fall between the cracks, like when they're leaving the hospital and going home and don't have their medications, or when they are moving from a doctor's office and leave the doctor's office and don't know what they really should be doing to manage their own care. They had a great visit with the doctor, but what do I do when I go home and I've got heart failure, and do I weigh myself daily or weekly or weigh myself at all to make sure I'm not getting into worse heart failure and filling up with fluid? Those are the sorts of issues that permeate our system. In response to that, the Robert Wood Johnson Foundation started Aligning Forces for Quality. And it's going to be their signature effort. They're the largest healthcare philanthropy in the country, their effort to improve the quality of healthcare that Americans receive. And it's based on a critical thing which I hope will resonate in this room. We hear all the time about national health reform, about the problems in national health care, how much we spend as a country on health care. But people don't get health care in America. They get health care in Grand Rapids, in Kalamazoo, in Bethesda, Maryland, where I live. They get health care in their community. And that's the context for the system that they navigate, that they negotiate every day in terms of the care they get. We don't think that quality is just about what doctors and hospitals do. We think it's also about what people do, patients, consumers. And we think there's two things that consumers can do to help in their own care as well as improve quality overall. One is as they start to get information like this on quality around hospitals or doctors or others, start to make decisions around that. Well, maybe I'll, go to this hospital rather than this other hospital because it has higher quality. Or maybe I might go to a different physician because, I saw this report and this physician group is doing a lot better on quality than this other group and providing better care. So we're hoping to get the information out there and hopefully get consumers engaged and actually using it to make decisions. That's new to healthcare. We really haven't done that before. The other thing we want to do is also make sure that consumers start to have the tools they need to manage their own care. Because that's part of it. I go to the doctor every year, and every year I take Lipitor for high cholesterol, and I have a number of other small problems which happen when you start to get into late middle age, like some of us. And every time I go to my doctor, I have a great visit, and he's wonderful, and he's charming, and I think he does most of the right things. And I come home, and my wife asks me, what about these 5 things? I guess I forgot. Well, she's a doctor too, by the way. Most health professionals in America aren't doctors. They're nurses. And when you look at polls and surveys and focus groups, the key indicator of whether or not somebody in a hospital thinks they got good care was nursing, not the physicians. We also know that most people turn for advice on a day-to-day basis for their health care to the nurse down the street, not physicians. And we think that nurses have a role to play in all 3 of these areas. We now have measures of things that really relate to nursing care and the quality of nursing care, like do patients have ulcers or do they fall while they're in the hospital? Nurses can help hugely with consumer engagement. More and more health systems, including systems here have nurses teaching patients how to take care of themselves when they go home from the hospital. And nurses have a huge role to play in terms of quality improvement because they're with the patient 24/7 and they know what's happening. And the second big theme we have is equity, as I mentioned before, so that everybody should get the same level, high level of care, regardless of race or ethnicity or gender. Yet we know there are big gaps based on those things. Women don't get the care they need for heart disease very often. African Americans don't. Latinos don't. These are big issues we need to address. So this is an example in Cincinnati here, where our local alliance is the Health Improvement Collaborative of Greater Cincinnati. In addition to getting funding from the Robert Wood Johnson Foundation, there are 2 community foundations also funding their activities. They're developing a diabetes consumer support tool so that consumers know how to look for high quality care in diabetes. They actually have 11 primary care practices or doctor's offices who have gotten together to improve the level of diabetes care they provide in their community. Diabetes is a huge issue everywhere in America, including here. And they're funding a staff person in this local initiative to work with hospitals in the area to work on issues around disparities, race, ethnicity, and language, so they can make sure they provide high quality care to everybody in their community. In Buffalo, New York, another one of our grantees, the P2 Collaborative of Western New York, also has 2 community foundations working with them, and they're working on the consumer engagement part of it, funding a social marketing campaign, My Health Counts, in partnership with the local PBS station, expanding their work into 2 additional areas, 2 new cities, and supporting their activities where they actually have nurses trained in quality improvement going to physicians' offices in their community and saying, let us teach you and your staff how to measure quality in your medical practice. Let's show you how to go through your charts on your patients and figure out if you're providing the right care or not. Look for flags or issues where there may be problems and teach you some basic tools to make sure you're providing the best care. And they're actually funding some of these local activities in that community. I think the one thing I would sort of walk away from, I hope you'd walk away from, is, I think that foundations, be they national or local, are to some extent or largely in the social change business. And from the perspective of a national foundation, they can fund, as the Johnson Foundation can fund millions of dollars in local initiatives like this. But if there's no local social validation and engagement, it'll just dry up and blow away as soon as the money's over in 5 or 10 years or whenever. And that's where I think local support becomes so critical from local philanthropy. And part of that is money. Money is good. But I think in the long term, for these initiatives around public reporting to be sustained, they have to be viewed as part of the local fabric, as something that's accepted, that is validated by social networks in each community, by both elites and others, and something which has value, which the local community or elements of that, be it health plans or hospitals or business, are willing to support financially. Getting to that state is hard, and I think having the imprimatur of the local philanthropy is absolutely critical.